Hello, everybody, and welcome to this webinar of addressing AMR issues of the knowledge dissemination dialogue started by FAO already a few years ago and which has now become a traditional appointment twice per month. I must say maybe good afternoon, since I believe that most of the participants are based in the Asian continent and in Thailand. I'm particularly happy today, and we attach specific importance to these webinars because we normally display them in the FAO YouTube channel. So even after the participation in person, normally the video of the presentation, the webinars are accessed by a few hundred people who go in the YouTube channel and look at those. So they're particularly important for us. I would like to remind everybody that they're organized by the FAO Working Group on Antimicrobial Resistance, together with the FAO Sustainable Livestock Technical Network in the framework of the Renofarm FAO-led initiative, and also with the support of the ACT project, supported by the government of the Republic of Korea. So thanks to all the members of Renofarm and also the government of Korea and the colleagues of the ACT project and all the other FAO projects. As I was saying, the presentation is going to be recorded, and so the webinar is going to be recorded, and together with the presentation, we are going to share with not only with our participants, but with all members, the few thousand members of our networks. So we will post it also online on YouTube, so you will be able to access it also later on. We will have our well-known colleague, Julaporn Srinha. I'm particularly happy to have her speaking with us today because of the long-lasting relationship we've had. So I know how active she has been, and I know how active the Minister of Agriculture and Cooperatives and the government of Thailand have been in addressing AMR. So I'm happy that she can share with us the lesson learned from the work. And the national action plans are the backbone of the work of all countries addressing the threat of antimicrobial resistance. So we will have her talking for half an hour, and then we will have half an hour for your questions, discussion, and so on. Again, so have some patience, and you will be able to address her. And I think, Marina, we can move to next slide, please. So just, I think by now you're all very, very well acquainted with webinar etiquette, but just to remind you some important points, you can look at what's on the slide. Next one, please. Okay, and don't forget that we meet every 2 weeks. So our next webinar is planned for 10th July. And now, without further ado, I will give the floor to Julaporn, and I'm looking forward to hear a very interesting presentation from our side. Thank you very much.
Thank you, Daniela. Greeting from Thailand. And now we can, for my side, we can say good afternoon because it's a 2:30 p.m. in Thailand. Let me share my slide. You see my slide or not? Okay. Firstly, thank you so much for FAO team in terms of AMR. Also, Dr. Daniela to invite me to join the webinar today. And today, my presentation is the National AMR Strategic Action Plan for Animal in Thailand. Because I from Department of Livestock Development, Ministry of Agriculture and Cooperative. Mainly, my present is focused on agriculture sector, in especially for livestock sector. I think Thailand look like other countries. We do for AMR containment under the National Action Plan on AMR. And now Thailand we have two phases of the National Action Plan on AMR. The first round is the Thailand National Strategic Plan on 2017 to 2022. And now we in the era, the second Thailand National Action Plan on AMR. I would like to review our job that we have done before of Thailand. So you can see our Prime Ministry participate in UN Assembly since 21st September 2016 in New York, USA. At that time, we launched the first round plan of AMR Thailand. You can see in the picture on 21st November 2017, we have the action line Thailand mark the spot to stop AMR mission at the government house. After that, 23rd November 2017, in Thailand, we invite about 74 organized to sign the declaration of a call to action against AMR Thailand. At that time, aligned with the National Action Plan, we have the committee as the National Committee on AMR of Thailand. The chair of the committee is Deputy Prime Minister, serve as the chair. And we have three main ministries from public health, agriculture, and cooperative. Also, Ministry of Natural Resource and Environment serve as the chair. And my DG of DOD, Department of Livestock Development, act as the secretariat, co-secretariat. And the secretariat is Thai FDA. We can say in Thailand, we move under the National Committee on AMR, belonging the plan. For the first round plan, 2017-2072, we have 6 strategies for our in charge, mainly in charge for 2 strategies. The strategy 1, AMR surveillance using One Health approach. For the strategy 1, the focal point is Department of Medical Science from human sector, human public health. For us, DLD Thailand focus on strategy 4, AMR containment and antimicrobial use in agriculture and animal. We have a goal for the animal sector. Our goal to reduce at least 30% reduction of antimicrobial use in animal. This is a goal. In addition, we would like to, on the capacity address on AMR, achieve score 4 of JEE 2. As AMR, we can say Thailand, normally we do for the food safety. AMR one topic under the action plan. You can see the left hand side. AMR, the topic we do for among the transdisciplinary. We need to know about antimicrobial use on collecting the data. We need to know about veterinary drug regulation because antimicrobial resistance, the problem, very close with the vet drug regulation and antimicrobial use. Not only the AMR, we need to concern for vet drug resistance in terms of food safety, and also the surveillance and the analysis for the risk analysis on AMR. This is a topic that I think every country, the core person, the focal point need to understand about the topic, the complex. If not, we cannot clarify how about the AMR, how about the different at all. We work with the multi-stakeholder in under like our national level Also, the global level, right, the FAO, the WHO, WOA, and also UNEP. Now we can call quadripartite. Not only the global organization, we need to concern on our standard in general, the codex, and also our exporting country that we export to them like EU. Not only the government sector, not only the three main ministry, we need to work with the Vet Council, Thailand Veterinarian Green Consortium Association, and we can say we work very closely with the veterinarian who in charge in each species, right? Swine, poultry. When we would like to work for the medicated feed regulation, we need to understand on medicated feed regulation, work with very closely with Feed Mill Association as well. In today, luckily now is a day 2 of the FAO meeting in Thailand. It's a regional workshop for private sector engagement on AMR. Sometimes the participants join the meeting in the hotel today. Today is the key is a private company, private sector to in charge. Today is we invite nearly 100, is about 94 participants organized by FAO, WOA in terms of the tripartite on EU project. Very, very fantastic in this moment. We turn to the role of Department of Development in our containment. We can find we need to have develop the mechanism. We need to have the committee, subcommittee, and the organized in charge. After that, to know about the situation of the surveillance, we need to have the surveillance system of the AMR. We have the national surveillance on AMR in the food chain. We collect the sample per year, more than 5,000 samples per year that comply with the WOA and FAO. And we have the strengthened 2 months ago, we just finished on the project to strengthen lab sector in terms of the tripartite on EU projects as well. So we need to focus on the PT, the methodologies to surveillance, because we need to harmonize for the lab sector as well. To reduce antimicrobial use, we need to do for the regulation. Thailand developed the regulation. For example, we prohibit the use of antimicrobial as a growth promoter. We regulate on the medicated feed regulation. We need to veterinary prescription and also the ICT to collect the data. And we do for the classification and control distribution of antibiotic. Like post-marketing, we had a law enforcement. Not only the regulation, we need to promote in terms of the prudent use, regional drug use. We have the many projects in terms of the intervention to do for the reduction of the usage of antibiotic in animal sector. To all of them, we need to collaborate one health approach, association with council, and like international organization as well. This is the role of our department as a government sector to work with in terms of AR containment. This slide to show the strategy 1 under the national strategic plan. The strategy 1 is the AMR surveillance system is capable to indicate the problem as well as the monitoring and report of the AMR. The focal point is Department of Medical Science. For my job and my department in charge more strategy 4. This strategy, we have the subcommittee to activity with the multi-stakeholder. The strategy is AMR prevention and control of the antimicrobial stewardship in agriculture sector in animal. You can see prohibit the growth promoter, we need to reclassification together the strategy 2, like a drug distribution. And we have the quick win we had the regulation for medicated feed production. And we had two main projects, like race without antibiotic, RWA, and also reduction of inappropriate use of antibiotic initiative. You can see the logo under the slide. You can see Thai Feed Mill Association, Animal Health Production and Association, and also the Vet Council, our Ministry of Agriculture and Cooperative, MOAC. On the agriculture sector, we need to work very closely with Department of Fishery and also the crop sector as well. This slide, I would like to show before we collect the antimicrobial use in each sector, we need to know where the drug, how's about the distribution in the country. This picture to show us about drug distribution in Thailand. You can see it. You would like to collect the data at feed mill. We need to know where we collect the data at the feed manufacturer. This if we the country don't know drug distribution in their country, it's very hard to collecting the data as an amount of antimicrobial use in the units in each country. In Thailand, we very complicated because animal drug and human drug under the same act is a drug act. And after we have the National Action Plan, Thai FDA did a secretariat of us. After that, we work together to do for the antimicrobial use consumption in terms of the data baseline. Because if we would like to reduce antimicrobial use, we need to know the baseline. Here is the consumption of antimicrobial agent in Thailand. And we launched the first report in 2017 on the Prince Mahidol Award Conference in 2019 in February. And at that time, the unit that we choose to use is we calculate on the unit milligram per PCU Thailand. And you can see we received the AI from Thai FDA, the company who import and produce AI in animal sector. They need to report every year to Thai FDA. After that, we have a PCU in kilogram PCU in terms of the biomass. You can see we use the milligram per PCU in terms of PCU on the food producing animal. This is the unit we choose at that time methodology of Thailand. This slide to show the Thailand surveillance of antimicrobial consumption. You can call the short name ThaiSect. We start with 2017. You can see we can reduce. Now we have the data on 2022. We can reduce as a whole antimicrobial consumption in national level about 60% reduction. And now we on the process to do for 2023 and the next. That we can say Thailand reached the goal we set for the 30% at the end of the phase 1 AMR action plan of Thailand. Return to the regulation. In Thailand, regulation on drug, we complicate like Thai FDA and my department, DLD, and also the ACSS who in charge on the codex, like Secretariat of the Thailand. Here you show the ban of antimicrobial use as a good promoter. We total ban since 2016. Before we ban the hazardous drug like notofuran, chloramphenicol, and so on. This slide to show the reclassification. Now Thailand, in terms of medicated premix under the Drug Act, to mix in feed we need the prescription. And all of the drug in the slide, quinurone derivative and cephalosporin, macrolide, and polymyxin is a special control and needs the prescription by the vet. Not only the growth promoter ban, this slide show we not allowed to use antibiotic, all of them mix in feed for prevention. And also we not allowed use the cephalosporin mix in feed as well. This slide to shows about the medicated feed regulation. You can see at feed mill level, to mix antibiotic in feed, the feed need to have the manufacturer needs to have the GMP certification and had a prescription from the farm level as well. When we launch the new regulation, we need to communicate, we need to train, we need to give them to know. For example, the slide shows about the training in terms of veterinarian who in charge at feed mill level and also the farm mixer. And this slide shows about public-private partnership. We have every year we can say we have a World Antimicrobial Awareness Week. We invite a multi-stakeholder, normally about 200 participants to join. Sometimes we have a hybrid as well. Yeah, we have a train last year between private sector, government, also the FAO and WOR to know the data as a surveillance data, antimicrobial use, antimicrobial to mix in feed. We have the ICT system to collect the data. After that, we can calculate. After that, we can use the data as the policy level as well. This slide, Thailand invite the private sector, the company, the farmer, and veterinarian who involved the production of the animal production to reduce antimicrobial use, to run the pilot project on red without antibiotic, to communicate what the rule, what the activity, what the submit, and what the document we would like to follow and certificate them. Here is the red without antibiotic MOU between the market who sell the product and the company who in charge the farmer, the production, and also the government like DOD to give them the certificate for RWA. We found that when we investigate the success of the project, pilot project, we found that the farm needs to have more in terms of biosecurity and effective on herd health management program and also farm management. In addition, they use the alternative product like a herb, a vaccine, and need to do more for the biosecurity and also the animal welfare. Either the RPA project we show for the national level to let them multi-stakeholder to understand, and also the policymaker to know about the chain of the project and the success story of them. This slide show the national action plan or the plan or M&E, the result, the guideline, and the brochure, and the media, and the summary about the AMR Thailand in hand of the paper, the printing, and also we have the website as well. Thailand, as we have the goal to reach score at least score 4 JEIHR evaluation, and the first in 2017 you can see our score very low for the antimicrobial stewardship activity. Our score is only 2. For the next 5 years, 2072, we received the evaluation again, IHR JEE. You can see the score is improved. For example, multi-sectoral coordination on AMR, we received the highest score, score 5, and all The next is surveillance AMR prevention, both in human sector and also optimal use in human and animal. We received the score 4, and average total score we received 4.2. That means we reached the goal we have set, like a 30 reduction. Our score, our reduction is 60%. When the IHRJE, we proposed to receive 4, we receive 4.2. That means we succeed in terms of the implement of the plan of our country, Thailand. For the next AMR, we invite multi-stakeholders again to do for the plan. And now we on the 2022 and 2027, the phase 2 plan. And for the current plan, phase 2 plan of us, we need to have the baseline data of the reduction 2017, the next 10 year, the next 10 year, 2027, 10 year, we need to reduce at least 50% of the usage of antimicrobial. Here is the project, the activity under the second round plan of our plan of AMR Thailand. You can see we align the PHO, FAO, and we now going on the step we have done. For example, we need to do the data antimicrobial use. Now we would like to do for at farm level collecting data. And now not only the mass 50% reduction for 10 years, we need to focus on the HPCAA drug like coricin. We would like to reduce the usage more than 20% normally. And we work with the DOF aquaculture. We have the guidelines. We work with the ACFS under the comply of the codex in terms of the prudent use to achieve as well. And this project, we need to promote the use of alternative, and we like to use more alternative to reduce antimicrobial use, like a vaccine, to promote and research on the alternative as well. Here is we need to develop the capacity in the knowledge, and at the agriculture sector and animal sector. And we just last year in June, in this moment, we have the 4th National Forum on AMR. We invite multi-stakeholder. At that time, we invite the on-site 2,200 participants, and we have the virtual meeting, and they engage about 2,000 engage of the participants at that day. After that, we have the M&E. After the mid plan of the phase round plan, we need to invite to monitor how about we are, what the next step we have done. Not only the paper we print it out, we have also the website. You can show the link and the document I attached via the email to if you would like to select more and receive more. That is as a whole that I used to present today. Thank you so much. I finished my presentation.
Thank you very much, Julaporn. I just needed a few seconds to switch my audio again. Thank you very much. Very interesting. I think I would like to present my congratulations, as I was saying at the intro, for the very good work in terms of amount, but also in terms of quality that the government of Thailand has done to address this important issue. And I would like to know if there is anyone from the floor who has any question from Julaporn, please post in the chat. And yes, please, we are not going to allow anybody to speak, but please write your question in the chat box, and we will address it to Julaporn, and Julaporn will reply. And I have in the meantime a question myself. So you were mentioning that you were giving training to the relevant parties about the new legislation and what I think the producer, either in the feed, on the livestock farmers or the livestock industries, they have to do to comply with the legislation. Could you please be a little bit more specific about which kind of training? Was it very technical? Who were you addressing? How many trainings you have done in the whole country? You know, have a little bit more details, because I think it would be interesting not only for many countries, many other countries, but also for FAO, because we have been addressing also those kind of issues, and we have organized those kind of activities. So I think we could benefit from your experience. Thank you.
Thank you, Darella, and greeting again from our participants. Okay, in terms of the training for our country, Thailand, we need to specific what the training, what the message. For example, I would like to show us about two main training we have. For example, if we launch medicated feed regulation, that means we need to specific who in charge. We need to specific the veterinarians, mainly private veterinarian. Two of them, one who in charge in the feed mill, who control the mix of antimicrobial in the feed mill. Also, the veterinarian who in charge at farm level, who prescribe, who take care, supervise the animal health at farm, and prescribe to the feed mill to mix. Two of them need to know the regulation. For example, the veterinarian who in charge at a pig farm, who in charge in the broiler farm, layer hen, they need to know what the ban, what the prescription, what they are not allowed to use as a growth promoter, what are not allowed to prevention. After that, the feed mill, we have a train at least 2 days for the training about the group, about the CV, about the homogeneity, carry over, and the guideline. So we need to have the what we call specific message and the training for each group to understand the message, the same message, medicated feed regulation for the farmer, farm mixer, for the veterinarian, and for the feed mill. Not the same message, the complicated, not the same, but is that only the same thing, medicated feed production. And in addition, for red without antibiotic, we need to let them know about the rule, the certificate, and the checklist to understand before we run the project like red without antibiotic, the specific like that.
Thank you very much. So it means you are addressing mainly vets.
Yes, because Thailand normally we have the vet school. They receive the study for sick and receive the graduate. Okay, the general vet. However, the vet who in charge for the GAP farm, they need to receive the certificate for supervised, and we have the training for specific for the protein, for the pig, specific again for the ruminant. In addition, we had a training for the vet who in charge in feed as well. We have a variety of the vet group, and sometimes veterinarians have many had to do. Sometimes they in charge at a farm level, sometimes they in charge in the feed mill.
Thank you. Thank you very much. And we have also some other questions from the floor. So one question is alternative, like the herbal treatment or traditional, I think the question is, have you tried alternatives to the use of antimicrobials as herbal treatment, or based on traditional knowledge? Any practice that you have tried in Thailand?
Luckily, let's say fortunately, Thailand had the domestic consumer and the consumer outside and exporting country like us. We have the contact need to do for the premium markets as well together. And in terms of the alternative, we need to work with the enforcement. If you would like to not allowed to use as growth promoter, not a prevention, and would like to show the data reduction of the antimicrobial use year by year by year. You need to enforcement exactly together with alternative. We cannot succeed to promote alternative if we not enforcement much more in terms of the regulation, the ban of antibiotic. Because if compare the alternative, the antibiotic use is very easier and sometimes it's cheaper. After that, we have the research to support how effective, how about the production, how about the cost. And after that, for example, for Thailand, for boiler sector, for example, we have about 10 big company in charge in terms of the boiler market, and they competitive themselves. They would like to show the reduction of the microbial use. For today, we have the private sector. They would like to present how percentage they can use. Some boiler, they reduce more than 90%, and they show the brand of them. This is a positive impact to success story together.
Thank you very much. Is there any other question from the floor? Otherwise, I have, because I have too many, but we have another question. What types of action are you taking to promote public-private partnerships to reduce antimicrobial or antibiotic use?
Okay, Thailand use PPP so many, and now today with the FAO, OR, we do for PPP again. In PPP, private is a private, and the government like me, like us, is a public. I just know the government is a public in the PPP. To do for the PPP, for my point of view, we need to invite them to discuss and give them, if we not to do collaborate very tough, collaborate very closely, what the negative, and see the future together. For example, we focus on to not use coercing the next 3 year, 5 year. We need to understand how many coercing in our market. How's about the next 3 year? What the red drug to replace coercing like HPCAA, something. So the communicate, the understanding together, the goal together as a whole, as a national level, we can go step together.
Thank you very much. So have you, as this public-private partnership resulted in any concrete output, in anything concrete that has been done, any project, any activities that has been done together, the government and private sector?
Yes, and if the government sector, if a limit of the funding, budget, and the staff, we need to touch and cross with the, for example, academic sector, they have the day one curriculum, they need to input about the curriculum together. And for the staff like government sector, we need to in charge, for example, in the speaker, in like the panel, about the training, about association, to have the put about the message that we have in terms of the policy maker, to let them know how's about AMR containment, how about the next up we do for the plan of our country, Thailand, align with the quality Thai as well.
Thank you very much. Is there any questions? And while I wait for other questions, I would like to remind everybody that these webinars are not meant to be a platform for advertisement, nor for any commercial product, nor for any commercial or individual services. So thanks for understanding. I'm not talking to you, Julaporn. So thanks for understanding, and please refrain to post in the chat any kind of information on that sense. And we have another question from you. Are there rules and surveillance systems to avoid direct use of antibiotics without vet prescriptions?
The rule and surveillance system to avoid direct use of antibiotics. Okay. To know about the surveillance system, we need to collect the data, specific data, the level, the unit. For example, if you don't have the data in hand, the baseline, you cannot clarify, you cannot know where are you and what the next. For Thailand, I think we start the same. Before we have the plan on AMR, we have nothing about the data as well. However, we start with the consumption as a whole of the country. Before, we cannot separate between animal drug and human drug. Now we need to do for the distribution channel. After that, we have the whole of the AI for the drug. After that, we have the at feed mill level. After that, we have the at farm level. So if you have more enough information, the data collection, you can interpret and analyze what the not a prescription, what a prescription, how's about the difference between prescription and not prescription, and how about the illegal. For my point of view, we need to understand about the distribution of the drug chain of your country. In boiler, we can say mainly on the track, not illegal, but some species we have use not a prescriptions as well. For the boiler, we can say 100%. In addition for the medicated feed, mix in the feed mill, we for all prescription. Anyway, but small farm, sometimes we have not a vet prescription. We need to know. Understand the unique of your country. Thank you.
Thank you very much. Any other question from the floor? I think it's there are no other questions for the time being. So if this is the case, I think I will invite everybody to fill in the questionnaire that our colleague Marina has just posted. It's very important for us to have your feedback. I would like to thank again Julaporn for the very interesting presentation and for all the collaboration she's having with us, with FAO and other organizations, as you heard from our presentation. And so thank you very much. Keep tuned. You will hear from us. We will share the presentation and the recording together with other useful information. And we will meet you again in more or less 2 weeks with next presentation, next webinar on the 10th of July, this time in a time zone which is a little bit more comfortable for our participants in the Americans, in the other hemisphere. So again, thank you to everybody for keeping and being with us today. And thank you very much, Julaporn and Marina, of course, for all their support. Goodbye. Bye-bye.
Thank you. Bye for now. See you when we can. Thank you. Bye-bye.
Bye-bye.